Lacey, do you know what's happened to Keith?
No, he's off. He's still on my screen.
I can't see him. Should I start then?
Yep. So welcome everyone. We just a bit of housekeeping really. We are recording this for everyone's benefit. We're hoping to have it on the website eventually. Towards the end, we will be putting a feedback form for you to fill out. So if you would be really gracious and fill that out for us towards the end, that would be magic. And I'll pop that on, and I'll also pop the link to our website with all the resources for you. All right, Jane?
Thank you, Lacey. Okay, we're going to look at the direct enhanced services for 2021. And what we're going to cover today is that structured medication reviews and optimisation and enhanced health in care homes. So structured medication review and medicines optimisation. We will look at the cohort of patients who are eligible for the structured medication reviews. Those patients living in care and nursing homes, patients on 10 or more medications with complex needs, those patients on medications associated with medication errors. This covers GI bleeds, for example, patients aged 65 years or over who have been admitted to hospital with a GI bleed, prescribed a non-steroidal, anti-inflammatory and not prescribed a proton pump inhibitor. Also within this section, it's patients with acute kidney injury, patients suffering with pain, fractures and falls, respiratory and ACBs. Also eligible are patients with severe frailty who are isolated or housebound or have had a hospital or a fall. Patients using potentially addictive pain relief medications such as ketamine or codeine. CEG have produced a suite of searches to support practices to identify their eligible patients, and we will look at these shortly. So when you are carrying out a structured medication review, you should consider the following. Is the medication appropriate for the patient's needs? Is the medication effective? Consider brand or generic, which is the most cost effective. Drug interactions. Is the patient suffering from side effects such as nausea? Check the patient's compliance. Are they taking the medication as they should be? Is the patient taking over-the-counter medication or complementary medications? Also consider lifestyle such as alcohol consumption, exercise, smoking, etc. Also check whether the patient has any unmet needs. Okay, so the structured medication review template is available in most of the practices. So in BHR and City and Hackney, it's a standalone template, and it's also in the care home template. For well practices, the structured medication review template is slightly different and will be published to practices tomorrow. It's just been developed in line with Well CCG. I'm just going to take you through the template. This is a BHR and City and Hackney template. So you can see the top section is for the drug compliance. So it's medication taken, i.e. drugs not taken due to side effects or pain, has difficulty swallowing, etc. The reasons why the patient's not, so you need to check why. There's a section then on the medication monitoring, which looks at things such as patients on 4 more medications, medication reconciliation. If you've received a hospital letter, you need to reconcile the medication within your clinical system. The code for structured medication review is currently being rolled out across the clinical systems. Once it is available, we will update the template to incorporate it. This should be in the next week or so. In the interim, you can code the patient's medication review or polypharmacy medication review. There's also a section for resources within the template. We have produced a suite of searches of your eligible patients. We will be sending comms out later today or tomorrow with the details on where the searches are located and how you can copy them across and run them. As you can see in the top folder structure, the Structured Medication Review version 1 temp, and the reason we've called it temp is due to the fact that the actual Structured Medication Review code is not yet available. Again, as the template, we will update as soon as possible as the code is rolled out. The top search is all of your patients who require a review. We have also developed the individual cohorts in case you want to target a specific group of patients. Here is an example of a couple of the searches. As you can see, if you highlight the search, you can see in the description the criteria. So in the top example, this is all of the patients, and we've got the criteria from the NHS Business Services Authority and NHS Digital Medication Safety Indicator Specification, August 2019. There is a link at the beginning of the template, so when you get the slides, you can access the link. You can see in the second example for the acute kidney injury, what it's looking for. So it's looking for patients 18 years old or over, admitted to hospital with acute kidney injury, concurrently prescribed a NSAID, a RAS drug and a diuretic. Okay. We are going to take questions on structured medication reviews at the end, or you can either put them into the chat and we can have a look at them so we don't miss anything out. We are now going to look at the DES care homes. So the enhanced health in care homes. PCNs should have already agreed what care homes they are responsible for. This should have been agreed by the 31st of July 2020. Patients should have a named clinical team and PCNs will get paid £120 per bed per year. And obviously, as this started on the 1st of October, it's £60 for the first year. The DES also requires you to deliver a weekly ward round, provide patients with support and personalised care plans, and also to liaise with colleagues in the community and secondary care to ensure shared learning and continuity of care. So, ward rounds, things to consider during the ward round. Support plans, structured medication reviews. Does the patient require nutritional support? How is their hydration and oral health status? You should consider continence issues. Have they received their flu vaccination, pneumococcal, etc. if required? Are they suffering from ulcers or recurrent falls, and is the patient palliative? You should also consider their mental health and whether they suffer from dementia and whether they are at risk of emergency admissions. Again, CEG have provided a care home template. Again, this will vary slightly across each locality. Within the care home template, there are additional pages, things such as patient's condition, which covers things such as mobility, eyesight, continence, etc. There's a page to record falls, etc. There is also an LTC page, so if the patient is on a QOF register, It will show you what that patient needs for the specific disease they're suffering from. The structural medication review page is also in the template. Okay, assessments and monitoring. The DES requires the primary care networks to monitor the rate of emergency admissions, urgent care attendances, and the number of patients with a care plan. They are also required to monitor the number of patients seen in the ward rounds. Remember, you don't have to see every patient every time you do a ward round. The number of patients who have received a structural medication review and those who have had a delirium assessment. And now we can take questions.
So I have no questions in the chat at the moment. If anyone has a question, please do put your hand up. Jane, I think you've done amazing. No one's got any questions.
I don't know about that.
So what I will do for everybody as well is that I'll put the feedback form into the chat function for you. We'll also be sending these slides out via email, and they will also be available on our website. I have two hands up. Kerr, Melinda?
Yep. Hi. Hello. I just wanted to just add that the MO teams have been working very closely with Anna at CG and to actually get the templates ready, and we've been giving feedback. So I just want to say a big thank you to Anna, who's been really helpful and supportive. So we were able to feedback as a team some comments, and a lot of the clinical and network pharmacists have also been sending some comments through. And can I just ask a question, if I may? Hi, Jane. Hope you're well. I can't see you, but
Hi, Melinda. Hi. Yes,
hi.
I'm fine. Thank you.
Just a question to ask is, so we're drafting a comms with Anna. So can I just clarify with you? Is the comms already ready, or should we still continue to pursue getting the comms ready? Because obviously we don't want to duplicate, because we're planning to send our comms out later tomorrow, but we're going to link in with Anna first tomorrow. So could you just clarify, and then it will just stop us from, duplicating any comms that will potentially be going out twice tomorrow.
Yeah, Anna's going to be on annual leave, so I think Faye is going to be doing the comms. Faye, sorry, Faye, to put you in this. Are you aware of any comms that Anna's written?
No, I believe there's a meeting
Jane.
tomorrow
morning.
I
didn't clarify. Sorry, I should have clarified. So we're working with Anna to draft a comms. So if that's changed, then let us know. If not, we'll just carry on, because we're going to catch up with her just to clarify the comms that's going to go out. So that's all I just wanted to check with you. So we'll just carry on as we are then.
Yeah, just right? Carry on, Melinda. Yeah, that's brilliant. Thank you. Yes.
Okay. Yeah. Thank you.
Thank you, Melinda. I've got one more question for you, Jane, from Elizabeth and Hasna. What's the newest version of home template?
Can we just clarify what area Elizabeth and Hasnath are from? What region? What borough?
BHR.
That would be version 3.
Thanks, Billy Joe. Version 3.
Is there any more questions? No, well, lovely. Thank you very much, everyone, for joining us. Just to reiterate, there is a form in the chat function for you. If you could all fill it out, that would be great. I will also send it via email as well, in case people are having issues finding the chat function. And again, thank you very much. Thank you, Jane, for presenting.
Thank you.
And we hope you all have a lovely day.
Thank you.
Thank you. Bye.
Bye. Thank you.
Bye.
Thanks a lot.